Infectious diseases affecting the cardiovascular and lymphatic systems. The defenses of this system. The lymph vessels and lymph nodes collect fluid that leave the blood vessels. This helps to filter out impurities, and then of course they are armed with leukocytes, and that's, of course, our B cells and our T cells and all of our immune cells that are getting ready to attack. We can find those in our lymph system. Cardiovascular system is highly protected. However, if microbes do invade, they gain access to every part of the body. The bloodstream can also contain some circulating leukocytes too. We'll start with endocarditis. Inflammation of the endocardium, which is the inner layer of tissues that lines the heart chambers. There's acute and subacute. They have similar symptoms. In subacute, the symptoms are more slow and less pronounced, but they have fever, anemia, abnormal heartbeat. Sometimes they can feel like a heart attack, and then you can also have enlargement of the spleen. Common microbial causes, these are not the only ones, but some common ones. For acute endocarditis, this can occur when Staphylococcus species enter the bloodstream and attack a heart valve. Subacute endocarditis is most often caused by streptococci, like Streptococcus pneumoniae or Strep mutans, that resides within the body normally. Systemic infections. So these sites have no normal flora, so we shouldn't find normal flora, of course, in the blood or the lymph. Microbes may be present transiently as they're filtered out of tissues, but they do not colonize here in a healthy state. Growth of microbes in the blood is called septicemia. This is review. Presence of microbes in the blood, usually transient. That would be bacteremia for bacteria, viremia for viruses, and phagemia for fungi. So you get the idea. So with septicemia, that's when organisms are actively multiplying in the blood. There are many different bacteria and a few fungi that can cause this condition. Symptoms include fever. Patient appears very ill. They can even have altered mental state, chills, gastrointestinal symptoms. It's very widespread, of course, because the blood is traveling throughout the body. Increased breathing rate and even respiratory alkalosis. All right, so now let's start with some organisms that can result in this. Plague. Yersinia is caused by Yersinia pestis. It's known as the Black Death, or just more commonly now plague. It's a gram-negative rod. Rodents are the reservoir, and fleas are the vectors. And so what happens is a flea bites a rodent and then bites a human, and that's how it can pass to humans from rodents. There have been pandemics for this throughout history. Back in the 6th century, it's thought that 100 million people were killed by Black Death or the plague. It's still around today, but antibiotics are effective and monitoring systems catch this early, so we don't have those same kind of death rates. This image shows a swollen lymph gland on a person infected with the form of bubonic plague. The swollen lymph glands are termed bubos from the Greek word for groin, and so there you can see those large swollen bubos. There are 3 manifestations of plague. There's pneumonic plague, bubonic plague, and septicemic plague. Pneumonic plague is a respiratory disease. Bubonic plague is where the organism enters the lymph, is filtered by a lymph node, the infection persists in the node, causes inflammation and necrosis of the lymph node, and you get that swollen lesion called a bubo that we saw in the previous picture. Groin is commonplace. Septicemic plague, that's where the plague disease leads to massive bacterial growth in the blood, and you can even have bleeding into the skin and other organs, and that causes a red and blacky patchy rash because of the blood under the skin. This shows the transmission. Bubonic plague is transmitted via fleas from rodents to humans. Pneumonic plague is transmitted person to person via respiratory droplets. Tularemia. Francisella tularensis, also known as rabbit fever. It's one of the most infectious pathogenic bacteria known. As well as 10 organisms can cause disease. It's transmitted through skin breaks or tick bites. Spreads systematically to multiple organ systems and is fatal in around 10% of people. It is a potential bioterrorism agent, and so it's on the bioterrorism list. If aerosol transmission can be created, this would be very, very concerning because it takes very little very few organisms to cause disease. Symptoms of this: rabbit fever, lethargy, and even death. And you can even have skin lesions like what's shown there. Lyme disease caused by Borrelia burgdorferi. It's has a rodent reservoir and is passed via ticks. So ticks are the vector. It effectively evades the immune system because it has changing antigens, so it's very hard for the body to mount an immune response to Lyme disease. An autoimmune response can develop, which leads to arthritic, cardiac, and even neurological symptoms. Early symptoms is erythema migrans, which is a bullseye rash, shown here. It's a central indurated spot surrounded by a red ring, but only some people get it. It's less than 20%. So some people will not have that rash. 80% of people will not have that rash. It is a non-fatal disease, but it has progressive symptoms. It evolves slowly, and it can mimic neuromuscular and rheumatoid conditions, and this can take years and years to develop. Early symptoms include fever, headache, stiff neck, dizziness. And then the second stage, which again can take years, is where you have cardiac and neurological symptoms. Lyme disease is a zoonosis, so it's transmitted to humans from the natural reservoir, which are rodents and also deer. And I'll come back to that in a second. Transmitted by ticks. There's a little bullseye rash there, and you can see a tick attached. It's mostly transmitted via nymph ticks, which are the ones shown in the bottom picture, and that's because they're extremely small and they can feed for a long time without being detected. The tick secretes an anesthetic that basically keeps you from feeling pain when it bites. The tick has to be latched on for, it has to be over 12 hours, so the nymph ticks are very good at hiding and feeding for long periods. All right, here is the life cycle of Lyme disease. You have a mouse infected with Borrelia burgdorferi there at number 1. The infected larval tick keeps developing, and then in its normal cycle would then bite a deer. That host is necessary for it to complete its sexual development, and then it passes. It has offspring and it passes back to the deer. So to the mouse. So the tick needs both the deer and the mouse as part of its normal life cycle. The human is an accidental host. It interrupts the life cycle and gets bitten in this process. Infectious mononucleosis. So we just mentioned this very briefly when we talked about Epstein-Barr virus in the virus chapter. But infectious mononucleosis is mostly caused by Epstein-Barr virus. Not all. There are some other ones that can cause it, but that's the majority. Cytomegalovirus can also cause this, but Epstein-Barr is the most common. It has a long incubation time, 30 to 50 days, so often it's hard to know even where you got it from. Exudate in the throat, so it kind of looks a bit like strep throat at first. Skin rash, enlarged spleen, enlarged liver, high fever, and then you can get this cervical lymphadenopathy, which is shown in the picture, and lots of fatigue. It's extremely tiring and it lasts for weeks and weeks. EBV is a member of the herpes viridae family. It's one of the most common viruses around the world. Estimated 95% of the adult population has been exposed to Epstein-Barr, but only some will actually become infected. So 20 to 40% of people will become infected, and only a small percentage of those people will get mononucleosis. Some people get nothing at all. Epstein-Barr virus is contracted through direct contact with an infected person's saliva, kissing, coughing, sneezing, sharing utensils, sharing toothbrush, sharing drinks, stuff like that. Viral hemorrhagic fevers. The viral hemorrhagic fevers are a diverse group of illnesses caused by RNA viruses. All types of viral hemorrhagic fevers are characterized by fever and bleeding disorders. They range from mild to life-threatening. They are found all around the world. Specific diseases are limited to specific regions, and we'll talk about a few examples. Treatment for these hemorrhagic fevers, intensive supportive care, and in some cases, antiviral therapy can be useful. All right, I'm just going to talk about a few. We'll start with yellow fever in Central America. Mosquitoes and monkeys transmit this. So specifically, the monkeys are biting the mosquitoes and biting the people. It disrupts blood clotting and causes jaundice, which is why it's known as yellow fever. Dengue fever is in Asia and Central America. It's also transmitted by a species of mosquito. The victim is vomiting, passes blood in their feces and urine. They have lots of blood leaking from capillaries. It causes severe muscle and joint pain, and it's known as break bone fever because the pain is so severe it feels like your bones are breaking, even though they're not. Dengue fever responds very well to treatment. It's got a mortality rate of about 15% without treatment, and with treatment, it's less than 1%. Ebola and Marburg viruses. These are from Africa. They're the same viral family, but they differ a little bit. Humans contract the virus from infected animals, but you can pass it human to human. Severe bleeding, organ failure. The mortality rate is from 25 to 100%, depending on the outbreak location and the virus. Marburg has a much lower mortality rate, and Ebola has a much higher mortality rate. There's no treatment or vaccine. All you can do is supportive care. Lassa fever in Africa. About 80% of people that get this will be asymptomatic or have very mild disease. 20% will have a severe multi-system disease, and for these people, 50% of them will die. You can have severe hemorrhaging. A common complication is deafness. Rodents will shed this virus in their urine and droppings, and so so then you're having exposure from that. There is antiviral treatment. Okay, let's move on to Rocky Mountain spotted fever. It's caused by Rickettsia rickettsii. It's a gram-negative bacteria, an obligate intracellular parasite. So this bacteria lives inside host cells. Most prevalent in the southeast U.S., but can be found throughout U.S. and Canada. It is a zoonosis transmitted by a tick bite, and 3 to 5% of individuals will die from this infection. The first symptoms are fever, chills, headache, and a distinctive rash, and that's shown there, and it appears within 3 to 5 days. In most severe untreated cases, the rash can sort of fuse, and you can end up with these necrotic lesions. Cardiovascular symptoms, neurological, delirium, convulsions, tremor, coma. So it can become very severe, but there is antibiotic therapy.